Welcome to the webinar. We will be waiting a few moments to give people a chance to sign in and join us. So it'll be just a few moments before we start the actual program. Glad you're here. Just a moment more and we'll be with you. Good evening and welcome to Monday Night Mental Health. Tonight we're really excited about our program on eating disorders, and I think you will find it very informative and very interesting conversation. First, I should tell you about Monday Night Mental Health. We are a collaborative ministry between St. Joan of Arc Catholic Church and Bethlehem Lutheran Church. We joined together about 10 years ago, and so we could offer programs to a broader community. So tonight is one of those second Monday nights of the month, and this series is called Hope for the Journey. So we are talking about living with mental illness and that there is hope. There's a lot of hope involved with treatment and caring for each other and being partners in our life's journey. And this is our second program of the year, and this is on eating disorders, and we will have Ted Bowman with us next month, and you'll hear more about that at the end of the program. Before we start with the speaker, I would like to read a poem. We usually have devotions or a poem, a time to settle into the program before we start the meeting. And since we're talking about hope, I have a poem, Look for the Blossom. The blossom will always grow. The seasons will always change. People come and go. Their shadows comforting and strange. The flowers will always bloom once the darkness subsides. When every corner is filled with gloom, remember the sun just hides. Brighter days will follow, earth will keep moving. Look for the brighter color, help lift the darkness looming. Breathe in the air around us, close your eyes for a minute's rest. Live life for those who guide you, for this moment is just a test. You will get stronger, days will get longer, hope will flourish, and there'll be memories to cherish. So before we get into the speaker tonight, a little, housekeeping. This is a webinar, so you will not be seeing each other, you will not be heard, but there is a chat room as well as a Q&A. We would like for you to put questions you might have in the Q&A section. So at the bottom of your screen, in the iPads and Mac computers, it's on the lower part of your screen. Just click on that and the Q&A area will open and type your questions in there. There will be two of us reading those questions at the end to Dr. Taylor so she can answer your questions at that time. If you have any other questions or thoughts, please feel free to put them in the chat or the Q&A session. Okay, I think that's it for that. We are really excited tonight and pleased to have Dr. Dawn Taylor with us. She is a psychologist at Melrose Place, an inpatient outpatient center for individuals living with eating disorders. She has presented her work and her skills locally, nationally, and internationally. I think you will find her very interesting and full of information for you. There is so much more to eating disorders than anorexia that we often hear about. And she'll talk about the broad range and hope for treatment, how you identify an eating disorder. We're thrilled to have her here to be a part of it. And I just have to add, she's my daughter. So that makes it extra special to have her here tonight. So Dawn, welcome, it's yours.
Thank you so much. And thanks, Mom. Well, I thank you so much for having me and talking about a topic that has been part of my life and my career life for the last 15 years. I've been practicing as a psychologist with eating disorders. Like she said, I work at Melrose Center, which we have a 39-bed unit that houses people who are really underweight or medically compromised and need a higher level of care. We also have a partial program and an outpatient program, and I manage our inpatient program. That I have so much I want to share, and I think that's enough about me. So I'm going to jump right in. I'm going to share my screen here and get organized. So we'll go here. And sorry, I'm moving things around here. Right. Bear with me. There we go. Eating disorders are really quite complex, and there's so much to share. And I'm probably only scraping the surface of what I would like to share with people. But I want to start us with a short clip, and we'll start there before I dive too deep.
It's an issue that affects practically every woman and girl that I know.
I wasn't tall enough, I wasn't skinny enough, I wasn't blonde enough, I just wasn't enough.
For years, society has been telling women to be beautiful, as if that's the most important thing they can be. After I had my 3 children, I ended up hating my body. So I trained hard, and then, you know what? I'm standing there in my perfect body, and I'm not happy. Too much sacrifice, too much time, too much obsession, and it's just not worth it. I don't want my daughter to feel the same way, so I'm going to go find some answers. Why do so many people hate their bodies, and what can we do about it?
So Ricky, have you ever wondered what it would feel like to not worry about your weight?
I have no idea what that would feel like.
I will get body shamed by whoever's on the shoot.
I went through depression from hating my body.
Nobody should have to starve themselves to fit in with how a magazine looks.
This issue was much bigger than I ever realised. When I posted a before and after photo on Facebook, things went crazy.
She's bearing all to encourage women to appreciate their bodies.
It was headline news in Paris, in London, it was in the US, it was everywhere.
It just changed me, changed the way I see myself completely.
This body of mine, it's not an ornament, it's a vehicle.
It's not the main point of life, agonising about not having a body shape that the media insist that you should be worried about.
You open your arms to embrace others.
That for me. Let's go.
Darling girl, don't waste a single day of your life being at war with your body. Just embrace it.
So I play this because I think most people can relate to the pressures to feel fit, to be thin. People are trying cleanses and diets, extreme exercise programs, all in the pursuit of changing their body. So when does poor body image and fad diets become an eating disorder? What does an eating disorder look like? Him, her, or any of these people? If you answered all of them, you would be right. However, when I ask that question about what does an eating disorder look like, most people have an image of in their head about a young, very thin, frail, white female. The truth of the matter is you can't see an eating disorder, and an eating disorder is not about a size. Most eating disorders are about a mindset that is preoccupied with body shape and weight, no matter what one size is. And this preoccupation about body shape and weight leads to changes in behaviors, changes in mood, changes in emotions, and impacts overall functioning. It impacts social health, emotional health, and physical health. It can be a devastating illness. And in fact, eating disorders have one of the highest mortality rates of all mental health disorders. This just recently was passed by the opioid crisis that we're now in. So it is devastating, and it has a significant impact for people. Eating disorders are complex. So in order to effectively treat them, we first need to understand how and who they impact. Like I said, most people have a belief that eating disorders are really for young females. The truth of the matter is, eating disorders do not discriminate. Among racial and ethnic minority groups in the US is on the rise for eating disorders. And although most research has been done with predominantly young white women, we do know that eating disorder rates are similar among all races and all ethnicities. But people of color are less likely to get help. This is a multi-layered problem, but a couple of the things I want to raise with this is if people aren't looking for the eating disorder, so if they have a bias or a myth in their head, not only does the person themselves not really think about an eating disorder, but providers and loved ones, they're not looking for it either. So no one's asking the questions, no one's assessing, even though they might be watching someone struggle. The fact of the matter is, if we carry a bias or a myth about an illness, we can't see it, even if it's standing right in front of us. The LGBTQ community is hit quite hard with eating disorders, often again, that kind of pursuing body types and having a preoccupation with body. We do know that male teenage body image dissatisfaction has tripled in the last 25 years. If you think about it and look back even over the last several years, 10 years, we can see media really making it more pressure on males. We see jeans being sold with topless or shirtless males. We see underwear ads, and in these ads, it's defined abs, defined arms, chiseled face. So the more and more that the pressures are out there, the more we're seeing males become more and more preoccupied by body too. There is a bit of a difference between females and males most of the time. Females are often looking for being skinnier, being thinner, and where males want to be bigger and bulkier, but very defined and fit. So they're a little bit different, and when we learn to assess them, we can see them much better. We do know that 30 million Americans will suffer from a clinically significant eating disorder in their lifetime. And like I said, eating disorder really is not about size. It is about that war that video kind of pointed out, that war with your body, pursuing and trying to find something that maybe doesn't work for your body. So that's a little bit about who can have an eating disorder, which clearly is anyone. But I want to talk a little bit more about the different types of an eating disorder. Anorexia nervosa is, again, I think in that image that most of us have, what most people come to mind when they think of an eating disorder. Anorexia is often very frail and thin. There's an intense fear about gaining weight. There's often persistent behaviors that interfere with any weight gain, so over-exercise, maybe purging. And there's a big disturbance in the way which one views their bodies to what is actually true about their body. So they might feel fat when they're actually so thin they need hospitalization. So those are some symptoms or behaviors of anorexia. Sorry. The other thing you might see is constant pacing, standing. There's an intense fear about sitting down, as this person might perceive that they're gaining weight if they sit down. There might be a preoccupation with food, not about eating food, but maybe watching food shows, maybe baking, but they wouldn't eat the food. You also see a lot of anxiety about going to restaurants or eating in social situations. So social experiences really do change for them. High anxiety, very rigid sometimes in their thinking what they can do, lots of rules about food. Orthorexia, this has not made it into the diagnostic manual yet. This is a pop culture term. If I had to guess, this will probably land into the next diagnostic book for mental health disorders. But what this really is a preoccupation of what is healthy. So eating foods that you perceive as healthy. There's lots of rules, good and bad. I'll do this, I won't do that. Often food groups are eliminated or food categories. So maybe no sugary food, no processed foods. They might take out meat or gluten. And again, the anxiety about being around food or watching other people. So a person with this might not only be preoccupied with the health of their food, but the health of the food with people around them. As you can imagine, this will change often their social dynamics, going to restaurants, eating at dinner parties, all can be very challenging when this is kind of the main fear in your head. There's often nutritional deficiencies, often underweight. So that's, and often are categorized and diagnosed with anorexia, but the kind of main focus would be the health. There's also binge eating disorder. A binge is classified as eating a large amount of food, more food than most people would eat. It's usually high calorie dense food in a short amount of time. There's a feeling of feeling out of control in this, but with binge eating, there is a binge with no compensatory behavior. This is often correlated with obesity. There's what things you might see is a lot of repeated diet failure, a lot of fear about being around others or eating around others, very preoccupied with body in terms of feeling like people are judging them, they're judging themselves. So there's lots of body image dissatisfaction. The other thing that is often common with this is kind of and I talked about the kind of the diet failures and lots of kind of rotating through diets. A person might have a binge. There's lots of shame and guilt in all eating disorders, but after a binge particularly, lots of shame and guilt about that. And then the concept of I'll be good tomorrow. So the next day kind of starting on a diet, which might be quite restrictive, of maybe a small piece of fruit, a salad for lunch. Your body's biologically getting hungry. And so it's kind of building, and then another binge would happen. And then that cycle starts all over again. Bulimia nervosa. This is a diagnosis where there is a binge, but it's followed by compensatory behaviors such as overexercise, purging, diet pills, laxatives. This will be associated with any weight. So you might be underweight, you might be of normal or average weight, or a little overweight. The preoccupation with body is there. There might be intense fear about eating with people, which is a common theme with eating disorders because there's so much anxiety about eating. So behaviors around meals might change. You might see someone going to the shower or going to the bathroom after a lot of meals. With all the categories that I've talked about right now, there's often lots of reasons why not to eat with people. My stomach hurts, or I'll be eating with, Billy later today, or I already ate. So you see a lot of that with bulimia too. Avoidant restrictive food intake disorder. This is one of the newest eating disorders that we have. We now have, although it's been around, we just now have kind of a classification for it. This really comes under, I think, what we used to call kind of extreme picky eating. This might, and the reason for the avoidance or the restriction is typically falls into three camps. One, people might be afraid of aversive consequences. So they might eat and they're fearful that they'll choke, or they're fearful that they'll throw up, or they're avoiding or restricting food because of texture, or some people really just have no interest in eating. They don't really like it. They don't get hunger cues. So it's these three reasons that you might see someone avoiding food. Often people are underweight, lots of nutritional deficiencies because there's often very limited amount of food. They might eat 5 foods in total. So you might have a kid who one of his 5 foods might be macaroni and cheese, but it wouldn't be any macaroni and cheese. I can't just go to a restaurant and get macaroni and cheese. It might only be Kraft macaroni and cheese. This is for adults too, but that might just be how a kid would do it, or a food that a kid would like. As you can imagine, if you only have 5 foods that you're willing to eat that don't create extreme anxiety, going to restaurants, going to friends' houses, a normal dinner hour at a house would be next to impossible. So there's lots of disturbance in that, extreme anxiety, and can be of all ages. So that's a little bit about the main categories of eating disorders. So we know kind of who and what they are, but a lot of times I get the question of like, what causes an eating disorder? The truth of the matter is there isn't just one cause. It's not this causes an eating disorder, but there are lots of risk factors. Risk factors can fall into several categories, kind of the biological, the psychological, or the environmental. In the biological category, we have genetics, so a family history of an eating disorder, being female, and early maturation. On the psychological front, we have history of mental health disorders or physical disorders such as OCD, anxiety, depression, history of substance abuse, or type 1 diabetes. It's really important to understand that there's often co-occurring disorders. There's about almost 80% of people with an eating disorder will have an anxiety or depression disorder too. Often that was pre the eating disorder. Now, when you add the eating disorder, the anxiety and depression gets significantly worse. There might be more rigidity and more anxiety about more things and more gatherings. So that is something to be aware of. Personality traits such as perfectionistic and being impulsive are also risk factors of an eating disorder. In the environmental category, influences of peers and media, which I'll talk a little bit more in some upcoming slides, teasing, bullying, certain family dynamics, sports participation, especially in sports that focus on weight. So it's not all sports, it's the ones that have specific focus on weight. Culture of dieting and a history of abuse and trauma. Like I said, there is not one cause, and really no one is to blame for an eating disorder. In my head, I kind of think about it like the perfect storm. You might have a girl who's doing really well in school, straight A's because she's a bit perfectionistic, might be a little anxious, but doing really well socially. And then her friend group and in the family, but then her friend groups, maybe her friend group decides to, let's see who can lose 5 pounds. In that one push can kind of lead to, okay, well, if I could do 5 pounds, maybe I can do 7 pounds, and now I can do 9 pounds. And it just is this trickling because she had some risk factors. Or a male who maybe is a little anxious and is in sports, maybe is a runner, and the coach says, hey, we want to get a little bit more muscle. And so that just, for some reason, not the whole team, but that one person was then, I'm going to be lifting weights all the time, and I've got to cut back and eat more protein, and the rules all start forming in. So it really is a perfect storm, and no one is to blame for an eating disorder. So what can we do to help? Before I get too much into this, I want to read, and I'm going to answer this in a couple different ways, but I want to read a few statistics. And I'm going to read them out loud just because I think they're that important. Over 80% of 10-year-olds are afraid of being fat. Around 30% of 10 to 14-year-olds are actively dieting. 46% of 9 to 11-year-olds are sometimes or very often on diets. And 82% of their families are sometimes or very often on diets. Over 50% of teen girls and 30% of teen boys use unhealthy weight control behaviors such as skipping meals, fasting, smoking cigarettes, or vomiting. And adolescent girls who diet frequently are 12 times as likely to binge eat as girls that don't. The reason I think that this is so important is, as I've talked about some of the risk factors, but by the time, let me just say this, the preoccupation with body shape and weight starts early. By the time most people get to treatment, they have been practicing flawed thinking and behaviors that really are hurtful. We are a diet culture. And I say that with, sometimes we don't even know how much of a diet culture we are. I want you to just think about, this about dieting. 35% of normal dieters progress to pathological dieting, and 20 to 25% of those progress to an eating disorder. If I talked about the risk factors as dieting culture as being one of them, I want you to think about what you did last night. Did you watch TV? Did you pick up a magazine? Did you walk through the line at Target? So just think about that for a second. I bet all of you could name a commercial you saw about someone losing weight and their before and after pictures, or someone being pictured about, hey, they've gained weight, they've lost weight, or someone in a bikini or a bathing suit of, look at the baby weight they've put on, or hey, join Weight Watchers, or what have you. Like, this diet industry that we live in is a multi-billion-dollar industry that inundates us in every way they can. They make us kind of feel like we're not good enough. We take it on sometimes without even noticing the commercials on, but we're hearing it and we're seeing it. And it makes it to our conversations. So it makes it to our dinner table, it makes it to our social groups. So I started this off a couple slides ago by saying, what can we do to help? One, I think we can understand that we are in this diet culture and we can change that. We can turn off the ads when they come on. We cannot buy into those things. We can actively talk like, hey, that's not true. Or, we can talk against it. We don't have to put it in our conversations. So we can fight against it and start decreasing the risk factors. We are also consumed by media. Media can play some really good roles, but it also can play some not so good roles. What we do know is that there is a correlation for people and eating disorders in the magazines or the media that they read. So American schoolgirls who read magazines, 69% said the pictures influence their concept of their ideal body shape, and 47% say that the pictures make them want to lose weight. The average woman is 5'4" and 140 pounds, and the average model is 5'11" and 117 pounds. We are looking at standards or images that we can't create. So if you think about that kind of body dysmorphia or that body dissatisfaction, it's starting early and starts there. We are also a social media culture. Like everything, there's some good and also some not so good that can come from this. We do know that depression, anxiety, self-esteem, and eating disorders are connected to the use of social media. A study from 2011 found that the more times girls spent on Facebook, the more they suffered from anorexia, bulimia, and poor body image. And there have been plenty of studies that have replicated these findings. The study also found that the girls whose parents were involved in this media were more resilient to the negative impacts than those whose parents were not involved. Just a little, my own little, I guess, experiment I did. I gave a talk at a sorority a few years ago, actually now, and it was spring break time, and they asked me to come talk because during spring break, there's so much focus about putting their bathing suits on, that the fad diets come out, everyone's weighing themselves, getting on scales consistently, comparing how much weight they've lost. No one's eating. So they wanted me to come talk about how dangerous that is and about eating disorders. And of course, social media was a part of that. So I asked them all, I said, hey, everyone, take out your phone. And of course, they all had a phone and took it out. I asked them to get on Instagram. They all had Instagram, so got on that. And then I asked them to look at the first thing that was posted, a first picture. And then I asked them to read some of their comments. And they shared, and here were some of the comments. Oh my God, your legs, you look hot. I wish I had your body. And then it might be something else. And then the comments again about body. You're beautiful. I wish I looked like you. And the whole room kind of stopped because I think for the first time, they could sit back and see that, wow, what they're participating in and what they're doing is treating people, and themselves included, as objects, as ornaments, and not the instruments, not looking at pictures to capture moments and memories, but looking at pictures to capture an image of body shape and weight. So that sorority made a pact that they would not do that anymore, that they wouldn't comment on people's posts like that, and that they could do that together. So again, in the idea of helping, what can we do? We can make a difference, and we can start changing the risk factors, how we have dinner, what our conversations entail, how we use social media, and how we teach others to use social media. So even if we reduce risk factors, we won't eliminate eating disorders. So the other thing that we can do is we can arm ourselves with all the information we can to understand and to be able to catch on if someone is someone struggling with an eating disorder. So if we know the clues, and I won't read them all, and this is not a full list of them, but if there's dramatic weight loss or weight change of any sort, so big fluctuations in change, if they're avoiding meals or high anxiety about different kinds of foods, so mealtime behaviors have changed, mood has changed. Maybe they're taking lots of showers, they're eating lots of mints. So just understanding the cues and the clues when someone is struggling with an eating disorder, knowing what to look for. What we do matters. So like I said, be willing to change, be willing to be part of the change. It will make a difference, but also be willing to talk. Eating disorders are full of shame guilt, and anxiety. And if any of you have ever experienced any of those feelings, they're not easy to talk about. Most people who are suffering or struggling with an eating disorder don't come for help. Lots of loved ones around them can see them struggling, but are often so afraid of either making it worse, making them mad at them, like damaging the relationship, so they stay silent. And what I'm saying tonight is we've got to talk about the elephant in the room. We've got to bring that to the person. And there are some do's and don'ts with this. We want to be calm and concerned, of course, but we don't want to oversimplify things. We don't want to say, hey, if you just ate regularly, you'd feel much better. We don't want to give advice or become part of the problem. So we don't want to do things like, hey, I'll exercise with you and we'll do this together, or I'll start a diet plan with you tomorrow, or you look great. You don't want to place blame. It's not your fault. It's not anyone's fault. It's not their fault. And you don't want to oversimplify. So if you just ate better, you'd feel better. To remember that people with eating disorders, they have tried everything on their own. They wake up every day like it's going to be a better day. It's going to be a better day. They start thinking it's not the eating disorder. They're starting to believe this is just who I am. So we don't want to oversimplify. And then use I statements. I'm concerned that you don't eat your lunch or dinner. It makes me afraid when I hear you vomit. So those are some things that we can do to start the topic about how do you get help. The last thing is guide them to treatment. Eating disorders don't get better on their own. Be willing to make the phone call with them. Check up on them if they said they were going to make the phone call. Hey, did you call today? Do you want me to go with you? Eating disorders, in the process of going through them, people need support. So why treatment? There can be a lot of medical conditions that come from ongoing eating disorders, heart, liver, bones. So to kind of stabilize any medical conditions, to restore or stabilize weight, to interrupt or reduce eating disorder behaviors, to prevent relapse, and just to get new behavior coping mechanisms. So if it's high anxiety or depression, different ways to cope with that. Most of the time, people won't need a higher level of care, and outpatient treatment will be very effective. What we do know is best practices for an eating disorder typically involves a multidisciplinary team. It hits us from many ways. So the medical conditions, we want a psychologist, a registered dietitian, and a psychiatrist. Often medications can be really helpful given anxiety and depression. So best practices for treatment would be a multidisciplinary team. The good news is recovery is possible. I see it every day, and it's amazing to watch. There are some kind of indicators of a better prognosis. So the earlier you hit treatment, or the earlier you kind of make the intervention, I guess the better. The earlier the most amount of change early on is a good indicator of recovery. And also there's like this five-year window. It's not concrete. It doesn't have to be within 5 years, but that is kind of our good window of getting long and sustaining recovery. But it is possible, and people find their way through this all the time. I'm going to end with one more clip, and let me try to figure out how I'm going to do this. Oh, I think I lost it, so I don't know if I can do it now. Let me see. Bear with me. I think I lost it, so we might have to go without it. Yeah. Well, it was all about, they asked both kids and adults one thing they would change about their body. And they show all these kids who are like, yep, nope, nothing. I want a mermaid tail, or I want legs like a cheetah. And all the adults were, I would change this or that. So just looking at how we start and how we love our body when we start and how that can often change. So I will be around if you have any questions, and thank you for your time. I will try to get out.
Thanks, Dawn. We have 2 questions already for you. One is, do people go between categories described or generally stay within a certain category of the eating disorder?
That's a great question. They often vacillate between them. So you absolutely can start, your start could be with bulimia nervosa and years later have anorexia. So they're on a continuum, and behaviors can change kind of throughout. So yeah, once someone's diagnosed with one does not mean that's where they stay.
Thank you. Our next question is, in what ways has the COVID epidemic affected patients who were already struggling with eating disorder? And did the pandemic seem to precipitate a lot of new cases?
Yeah, that's a great question. It is really hard right now, actually. People are, and for many reasons, I think with eating disorders, a lot of coping comes through whether it's restriction or different behaviors. So I talk about kind of the body image, but people often use them to deal with stress and anxiety, to numb. So the intensity of which eating disorders are right now is high. So we have isolation, and we know with shame and guilt, there is a lot of isolation that happens. So that's been intensified with COVID and what we need to do. There's also been a lot of focus in the media of and I keep hearing it everywhere I turn around, I think people are calling it the COVID-15. And so there's this concern. And what happens is people hear that. So people who are struggling with an eating disorder hear that, and then they get so worried and preoccupied by that, then they kind of use measures to kind of fight against that or get more anxious about that. As I said, the co-occurrence between anxiety and depression or substance use disorders, those are really high. So if we're in a time period where things aren't super predictable and there's a lot of unknowns, so eating disorders are on the rise right now, and treatment is harder right now. So people are finding it harder to get to treatment and getting the help that they need.
Any other questions people want to put in the Q&A? Please feel free to do that now. We got plenty of time. I have a question for you, Dawn. You mentioned one of the sports, running. When I was growing up, I was involved with a wrestling team, not as a wrestler, but as a statistician. And I noticed a lot of the wrestlers had eating disorders and, would do the purging. So I was kind of surprised that there was other sports besides wrestling that might indicate the path down to an eating disorder.
Yeah. So what we know more about sports or athletes. It really isn't being an athlete in general, but any sport that has any kind of focus on body. So it might be gymnastics, it might be wrestling, it might be football for some, like bulking up. And so it's not always like a kind of a thin body frame, but we're talking about maybe wanting to be more muscular. So there's quite a few sports when there's kind of a focus on weight that will have a higher likelihood of eating disorders.
Okay. Are seniors at risk for eating disorders, like older people, seniors? And is that growing?
Yeah, actually, we're seeing, yes. I mean, I guess the basic, yes, anyone. And we're seeing that more and more. And often we're seeing sometimes kind of seniors have struggled with eating disorders maybe way long ago, and it's kind of rotating back. Some have kind of had underlying for a while, and then as isolation or things get harder or stressors become more kind of part of their life, the eating disorders can grow. So absolutely, it's a category in which it impacts.
I have another question just for myself, is that I have mental health issues, and I had asked my doctor one time because they had me listed as morbidly obese, but I gained weight because of medications, not because I was overeating. And they told me that poverty is not a eating disorder, because I told them that I was only eating one meal a day, because that's all I could afford, but I still put on a lot of weight. And they're like, well, poverty is not an eating disorder. And I wonder what your take is on that.
Well, I'm going to answer that in kind of a broader spectrum. Kind of like I was saying earlier, where if we have biases, if we have stereotypes of what an eating disorder is, we can't see what is right in front of us. So providers are coming from, not all providers, but if they don't have a good not every provider is trained in eating disorders. So sometimes they're what they know or what they understand, and it doesn't always pan out to be helpful comments or helpful in helping whatever person deal with whatever they're dealing with. So, I mean, yeah, I guess I can answer it that way.
Thank you. Another question we have is anything being done in our schools to educate kids and parents?
We're trying. Yes, I don't think enough. I mean, I have been to several schools to talk. I've talked, I mean, when my kids were in sports, I went and talked to the sports coaches and the different teams just to kind of highlight what I know. I've been an advocate in different schools about what they're teaching in health. So when my kids were asked to track their calories and what they were eating, I came in and did a whole presentation to the school and the health teachers and every other teacher that was listening. So more and more is being done. There's a lot being done with coaches, a lot being done with nurses at the school front. I think right now we're in harder times, but more needs to be done. I think, again, I really think people believe they can see an eating disorder, so they'll be on it. And the fact of the matter is we just can't. And understanding them and understanding the mindset behind them is going to be the most important thing versus this concept that we can see them. But yes, more needs to be done in school, but we're out there. People are out there trying to get people educated about it.
We still have time for more questions if anybody has any. It's not really a question, but it's a statement. I was talking about the wrestlers and the eating disorders back then and, what they would do to the extremes. But several years ago, they started where they checked the BMI of the wrestlers, and they can't be below a certain percentage or they can't wrestle. So do you think that's helped with kind of negating the eating disorders, or do you think that makes it worse?
Well, for someone who's struggling with an eating disorder, or someone who is kind of predisposed or has some risk factors, it's probably going to make it worse. What we do know is having scales, full-length mirrors around the house, like those things are just not very helpful. So a sport where you're getting on a scale and you're saying you can play or not play, it's going to be problematic for many. And again, it just leads us to be that mindset to be thinking more about body and weight versus the game or the athletics in general.
Thank you.
Yeah.
Well, we still have time for some more questions. If anybody has any, you can post them in the chat or the Q&A section. Well, I'm not seeing anything right now. Do you have any other things you want to let us know in this time, or?
No, I think, I mean, any one area that I hit could probably be talked about for hours in and of itself. So I really did just want to kind of give this full spectrum of that there is hope out there, that we can change, we can make a difference, and that recovery is possible. I want people to be able to see that this is an illness that hits and affects many people and families. So there we go.
Another question came through about what led you to this line of work? What?
Well, that's a very interesting question. I was in private practice when I first started, and I think this just came about, and I specialize, and then there was this area of specialization of type 1 diabetes and eating disorders. And I just became very interested in the medical components and just learning more about eating disorders, of how consuming they were. I don't know, it kind of spoke to me, and I jumped in, and I've been there ever since.
Is there one eating disorder that's more difficult to treat than others?
Well, I think it often has to do with kind of the co-occurring natures. So depending on where anxiety is, if there's traumas, yeah, I mean, I think at the longevity of how long you've had it. So there's factors that can make it more difficult to treat, or factors that make kind of overall recovery more difficult. So if someone's been struggling for 20 years and has never gotten treatment, that's going to be a little more challenging than someone who within the first 4 years got treatment. So I think it more has to do with what's co-occurring with it. If there's substance abuse issues, if there's other, versus just a diagnostic category.
Well, if we don't have any last questions here, I'll thank Dawn for her time tonight. And we appreciate you talking about eating disorders. I know it's not a pleasant thing to talk about all the time, but we appreciate your insight tonight.
Thanks for having me.
We're so glad you were able to join us, and we're thankful for our attendees tonight for the webinar. I just want to let you all know that our next program will be the second Monday of November, which is Monday, November 9th, starting with a virtual Zoom program like this at 6:30 p.m. And you can check out the Bethlehem Lutheran Church Twin Cities website or St. Joan of Arc website for the link coming up. If you are on our email list, you should get a reminder of the upcoming event as well. Also, we will be sending out a follow-up email possibly with about the Mental Health Monday programming. And then the one last thing I want to say is, if you'd like a certificate of attendance, please email Diane Warwick at Bethlehem Lutheran Church Twin Cities. And I'm going to put her email in the chat right now. Oh, somebody already did. Beat me to it. So you can just email her and you can get a certificate of attendance. And then again, our Monday, November 9th program will be at 6:30 p.m. virtually via Zoom webinar. And it's Path Towards Wellbeing, featuring Ted Bowman, Master of Divinity and author and educator. So we hope to see you, and if anybody else is interested in attending. It's Path Towards Wellbeing, featuring Ted Bowman. And thank you again for Dawn, and thank you all for attending. And if you have any questions, just feel free to contact us, and we'll be in touch. So thanks all for coming.